Hi, I'm Dr. Alan Mandell. Today I'd like to talk about a very important topic, a topic that is rarely ever talked about. It's called sex and back pain. Back pain limits people from doing many things. And there's one very important thing that couples need to do, and that's communicate. Communication is the key to understanding each other's needs and feeling the self-worth and the self-esteem that you should have all the time. One of the most important things to understand about lower back pain is that nerves play a lot of funny games. Here's a model of the spine. Looking from the side, this spine is facing the same way I am facing, looking that way. The lower back has a curve called a lumbar curve. When this curve comes back further, there becomes more irritation on the nerves that cause lower back pain, pain in the buttocks, tingling, numbness, pain down the leg that they call sciatica. If I show you a nerve, what it looks like, here is a motor unit, two vertebrae, a disc, and a pair of nerves that come off the lower back, we'll say, in this situation. When there's pressure on that nerve, you'll notice that redness is pinching or interfering on that nerve. And that happens when we lean backwards or if there's inflammation from a disc. So the key thing is, when we're in this position, we want to take the curve out. When we take the curve out, you'll notice that the yellow nerves, the holes, open up wider. When they open up wider, there is more room for it to breathe. Bottom line, less pain, less inflammation. So we look at sex and back pain in many different regards, but the most simplistic way that we all need to understand is how can we move on with our life, enjoy our life, and have less pain. Well, those people who have severe back pain, sex sometimes has looked like an exercise. That you may want to take hot showers, moist heat to warm up the muscles. If you have cold muscles and you're putting your spine into different positions, there's a tendency that the muscles may constrict and cause more pain in itself. Lying flat on our back with our legs straight out, there is 55 pounds of pressure on our spine. Just by bending the knees and putting a pillow underneath the knees when we're on our back takes off approximately 1/2 of that load on the lower back in itself. So I would recommend a person who has lower back problems, usually you are better off to be on the bottom, preferably with a pillow underneath your spine, if that seems to take the curve out of that lower back area, or by bending the knees. When the knees come up, it takes the curve or that lumbar lordosis out of the lower back, which eases a lot of the pressure on the lower back nerves. Another key position is side-by-side positions. When two people are side-by-side, if the man who has lower back pain, he would be the one behind his mate. Therefore, being careful not to put the back into a hyperextension position. When your back goes into a hyperextension position, like this, as you lean the pelvic forward, as your pelvic goes forward, you put more stress on the lower back, on the lower nerves, which can increase those nerves that are being inflamed and irritated. A female with a pillow underneath her stomach, laying face down under her stomach and her chest, will take out a lot of that curve in the lower back area, making it easier for her lower back as the man comes from behind. So in summary, The most important thing you need to understand is not to put the back into a hyperextension position where the pelvic is going forward. If you take that gap or fulfill that open space where that lumbar lordosis is in your lower back by putting a pillow behind the lower back, by bending the knees, and taking this curve and flattening it out and opening up those spaces where the nerves are coming out, it's going to take a lot of pressure and pain away from your condition. So if you're having pain during sexual activity, stop. Don't think of it as like you're playing tennis and you say just 3 more games or just 1 more set, because it's going to take so much longer to heal later. And be smart, because a lot of pain that occurs after sexual activity may not happen at the moment, because the high levels of endorphin being secreted from the brain will not allow you to feel the pain. So be aware of your body, understand each other's needs, communicate, and you will see a lot of positive changes in your life and your relationship. Make it a great day. I'm Dr. Alan Mandell.